Welcome to the deep dive. Today, we're getting hands-on, conceptually at least, with a really vital piece of kit for our confined space breathe safety teams.
That's right, the automated external defibrillator, the AED.
Specifically, we'll focus on the cardiac science Powerheart G5 model you'll likely be using.
Yeah, and this is all about being ready. I mean, when you're in those confined spaces, things can happen fast, hazards are real.
Exactly. Every second is critical.
So knowing this device, instinctively almost, is just crucial for that rapid response capability.
So think of this session, this deep dive, as a practical refresher. We want you feeling confident with the Powerheart G5.
Right.
Our mission here is simple. Give you a clear, memorable rundown, stuff you need for the hands-on work, and, yeah, for that assessment coming up.
And we're keeping it practical. No deep dives into the, super technical schematics or anything. Just what you need to use it effectively.
Good. And it's worth mentioning, right, there are those two main types, fully auto and semi-auto.
Yeah, that's right. The fully automatic one decides and delivers the shock itself. The semi-automatic, well, it advises a shock and then you have to push the button.
Okay.
But honestly, the core steps we'll talk about, they're pretty much the same for both.
And crucially, they both talk to you.
Oh yeah, voice prompts, text prompts on the screen, they really guide you through the whole thing.
Okay, perfect. So let's get straight to it. In simple terms, what is an AED doing? Why is it so important in, that sudden emergency?
Well, think of the heart's electrical system.
Uh,
Normally, it keeps a steady beat, right?
uh,
But sometimes that electrical signal goes completely haywire. One really dangerous rhythm is called ventricular fibrillation, or VF.
yes, okay.
Imagine like a drum line where everyone's just drumming randomly. Chaos. The heart quivers instead of pumping blood effectively.
Right, so no blood flow.
Exactly. And that leads to sudden cardiac arrest, SCA. An AED is designed specifically to deliver a controlled electrical shock.
To stop the chaos.
Precisely. It stops that chaotic electrical activity, hoping to give the heart's natural pacemaker a chance to, take over again and restore a normal rhythm.
So it's like a reset button for the heart's electricity.
Yep.
Got it. Now, when our team grabs that Powerheart G5 in an emergency, what are the key things they need to spot immediately?
Okay, let's focus on the visible stuff. First up, the display panel.
Right.
Biggest thing to look for there. The rescue ready indicator light, little status light.
Green is good, I'm guessing?
Green is definitely good. Means the AED's done its self-checks, battery's okay, pads are connected, it's ready to go. If you see red.
Problem. Needs attention.
Yep. Red means check the battery, check the pads, something's not right. The display also shows number of shocks given, a rescue timer, and those text prompts we mentioned.
Okay, rescue ready light check. What's next?
The pads themselves, defibrillation pads, they come sealed in a package, usually pre-connected to the AED. They're self-adhesive, got a cable, connector. Now, here's a really important bit for practical use. The standard pads, the ones already plugged in, they're for adults and kids over 8 years old, or over about 55 pounds.
So most situations you'll encounter.
Pretty much. There are pediatric pads for smaller children, but they aren't the ones pre-connected. You'd have to swap them out.
And something else about the pads.
Yes. Crucially, check the expiration date on the package. Always. Do a quick glance before you even think about opening it. Expired pads might not stick well, and that means they might not deliver the shock effectively.
Right, bad stick, bad shock. Makes sense. Check the date. What's the third key component?
The battery, the IntelliSense battery, that's the powerhouse. You can usually see its status. There are little green LED lights on it. More lights mean more charge. If you see a red light on the battery indicator itself,
Just replacing.
needs replacing pronto. You absolutely need a charged battery connected at all times for that rescue ready status to be green.
Okay, so quick visual check. Green rescue ready light.
Yeah.
Check. Pads in date. Check. Battery showing green. Check. Good to go.
That's your basic readiness check, yeah.
Right. So picture this. Confined space, someone collapses. Unresponsive, not breathing normally. What are the immediate steps with the AED?
Okay, first things first. Confirm they are unresponsive. Shake and shout. Check for breathing. Is it absent? Is it just weird gasping? That's not normal breathing.
Okay.
And for an adult or anyone who looks like they're over that 8-year, 55-pound guideline, don't waste precious seconds trying to figure out exact age or weight. Just proceed.
And call for help.
Absolutely. Immediately. Get someone calling emergency medical services, 911, whatever your procedure is. That needs to happen straight away.
Right. Unresponsive, abnormal breathing. EMS called. Now, the the AED itself.
Get the AED right beside the patient, open the lid. On the Powerheart G5, opening the lid usually turns it on automatically and starts the voice prompts.
So it starts talking to you right away.
Yep. Now, bare chest. You need to expose the person's chest, cut or remove clothing quickly. And the skin needs to be clean and dry if possible. If they're sweaty, wipe the chest down quickly. If there's really thick chest hair where the pads need to go and you have a safety razor in the kit, a very quick shave might help the pads stick better.
But don't delay too long for that.
Definitely not. Pad placement is the priority. Dry is more important than shaved, generally.
Okay. Bare chest, dry as possible. Pad time.
Pad time. The AED will literally tell you something like, tear open white package and remove pads. Listen to it.
Okay.
Peel one pad completely off its liner. Look at the picture on the pad itself. It shows you where it goes. Stick it firmly onto the bare chest in that exact spot.
Right.
Then do the same with the second pad. Peel it, place it firmly where the other picture shows.
And positioning. Does it matter which pad goes where?
Ah, good question. With these standard adult pads on the Powerheart G5, thankfully no. They're non-polarized.
Well, that's handy.
It really is. Either pad can go in either position shown. One less thing to stress about when things are hectic. Just get them on firmly in the right locations.
Great design feature. Okay, pads are on. What's next?
The AED takes over for a moment. It'll say clearly, do not touch the patient. Analyzing heart rhythm, please wait.
And that means everyone backs off.
Everyone. Hands off, no touching the patient at all. The AED is doing its critical job reading the heart's electrical signals to see if a shockable rhythm like VF is present. It might also warn you if a pad seems loose.
Okay, hands off. What if it decides, yes, a shock is needed?
Right, this is where that semi-auto versus full auto difference comes in, but the warning is key for both.
Okay.
If it's your semi-automatic model, it'll announce, shock advised, do not touch the patient. And then a shock button, usually clearly marked, will start flashing, probably red.
And someone has to push it.
Yes. The operator pushes the flashing button, make sure everyone is clear first.
Okay.
You typically have about 30 seconds or so to push it before it might disarm itself.
Okay, and the fully automatic version.
Yeah. That one will warn you. Shock advised. Do not touch the patient. Then it'll give a countdown, something like, shock will be delivered in 3, 2, 1. Then it delivers the shock automatically.
So either way, the absolute rule is nobody touches the patient when a shock is advised or being delivered.
Cannot stress that enough. Clear the patient.
Okay, shock delivered. Or maybe the AED says no shock advised. What happens immediately after that?
The AED will immediately tell you it is now safe to touch the patient. And then it'll likely say, give CPR as instructed or start CPR.
So it's straight into CPR.
Straight into CPR. Chest compressions, rescue breaths, follow the prompts. Some G5 units have an optional CPR device like a puck you put on the chest.
Ah, for feedback.
Yeah, I can give feedback on compression rate and depth. If your unit has it, use it. Follow the metronome sound or prompts. The display usually shows a countdown timer for the CPR cycle too.
And keep going until...
Keep going. Follow the AED's prompts. It'll tell you when to stop CPR so it can analyze again, usually after about 2 minutes. And look, if the AED seems to malfunction, if it stops prompting or something seems wrong, don't just stop everything. Good CPR is better than no CPR. Continue CPR as best you can.
Good point. Okay, so you're doing CPR, maybe another shock happens, more CPR, then the paramedics arrive. What's the handover procedure?
Okay, EMS is here. They're taking over patient care. If the patient is maybe starting to breathe, don't rip the pads off immediately. Leave them attached and connected. Let the professionals decide when to remove them.
Okay.
And to properly end the rescue session on the AED itself, just close the lid. But only do that after the patient is fully transferred to the care of the EMS team. Closing the lid records the event data and turns the unit off.
Got it. Leave pads on, close lid after handover. Now let's talk safety, especially for your teams in confined spaces. What are the absolute non-negotiables?
This is critical, especially given your work environment. Number 1, never, ever use an AED around flammable gases or in areas with concentrated oxygen.
Big one for confined space entry.
Huge. Sparks and flammable atmospheres. Extremely dangerous. Potential for fire or explosion. Just don't do it.
Okay, what else?
Water. Avoid using it if the patient is lying in standing water or if it's pouring rain. Try to move them to a dry area first if you possibly can.
Makes sense. Protect the device, protect everyone.
And we've said it, but it bears repeating. Do not touch the patient during analysis or during the shock delivery. Make sure bystanders are clear too.
Right. Anything else on the pads?
Yeah, keep the pads clear of any metal surfaces the patient might be lying on if possible, and make sure the pads don't touch each other. Also, if you happen to know the person has a pacemaker or an implanted defibrillator, you might see a scar or feel a lump under the skin. Try to place the pad at least an inch away from that device, not directly over it.
Okay, good tip about pacemakers.
And finally, remember these pads are single-use only. Once they're used on a patient, they need to be disposed of properly afterwards. Don't try to repackage or reuse them.
Got it. So, recap. No flammables oxygen, avoid water, hands off for analysis shock, clear of metal pacemakers, single-use pads, crystal clear.
Those are the big safety rules.
Okay, last thing. How do we make sure these lifesavers are actually ready when needed? Basic checks.
Super simple, but super important. Regularly glance at that rescue ready indicator. Should be green.
The quick look check.
Exactly. Maybe once a shift or whatever your protocol is. Occasionally, maybe weekly or monthly, depending on your procedures, open the lid and just check the battery indicator LED is still green, no red light. And always, always confirm the pads in the machine are within their expiry date and the package looks intact, not torn or opened.
So, green light, green battery, good pads.
That's your basic readiness check. Takes seconds, could save a life.
Absolutely.
Yeah.
So, I think the main takeaway for the Breathe Safety team listening is pretty clear. When that emergency hits, act fast. Trust the machine. Follow those voice and text prompts on the Powerheart G5. That's your best course of action.
Definitely. This chat gives you a solid mental framework. Now you take this into your hands-on practice. Get comfortable with the actual device your team uses.
Yeah.
Get your hands on it, run through scenarios, ask questions during that practical session. That's where the real confidence comes from.
Couldn't agree more. Knowing how to use this AED effectively isn't just another skill. It really empowers you. You become that absolutely critical link in the chain of survival for someone.
Especially within the unique challenges you face working in those confined space environments. It's a vital capability.
A vital capability indeed. Well, that's a powerful thought to end on. And that wraps up this deep dive. Thanks for joining us.